The purpose of pain is to serve as a warning signal to keep us safe. So when we feel a painful sensation, again, it's when our tissue is being damaged or is in danger of potentially being damaged. So the pain can come from inside or from outside, but in any case, it's a signal to tell you that something is potentially damaging your tissue, your body. And that works really, really well. Like I said, it grabs your attention. It immediately engages your higher cortical thinking centers to identify the problem and come up with a course of action. There's actually a synapse in the spinal cord. It doesn't even send information up to the brain, so you don't even have necessarily conscious awareness of it. But if you step on a tack, your foot comes up right away. It's not like, oh, what was that? Where is it? Your foot just withdraws, and that's the spinal reflex. So there's actually a synapse of neurons that just goes the sensory neuron to the spinal cord and goes right over to a motor neuron to pick up that, that foot, whatever it was. So we talked a little bit yesterday about phantom limb. So phantom limb pain is, say, if you have an appendage that is amputated and the nerve is cut, whatever was going on, I mean, and often maybe there was trauma or disease in the limb that is missing, so there may have been nerve damage done before the amputation, but in any case, when you amputate a limb, you're cutting a bunch of nerves. And so it might still feel like pain is coming from an arm, but the arm is not even there. So we know the pain is not coming from the arm because the arm no longer exists. So I think that's just a good example of like an aberrant pain signal gone wrong, but that happens not just when you have an amputation, it happens in lots of chronic pain conditions where you can't find anything wrong at the place where your brain is telling you that the pain is coming from. And that might not be where the problem is. It could be anywhere on that long track of the neuron up to the spinal cord, or even it can be originating in the brain. So someone was mentioning earlier to me today that their mom had a brain tumor that's causing chronic pain. That would be an example of centrally generated, generated within the central nervous system. So they call that central pain or centrally generated pain. Stroke and multiple sclerosis can also cause centrally, like in the brain where nothing happens out in the periphery, and yet your brain is telling you that your leg is on fire, for example, but it's really it may happen even within the central nervous system and nothing in the body. So where the pain signal originates and where it feels like it's originating are not necessarily the same thing, particularly when it comes to chronic pain. Like I said, many people might have an instance, a surgery, an injury, whatever it may be, that causes acute pain for some time, or even just an episode of low back pain, and then they'll go and see a doctor, whatever it may be, and recover, and it will go away. And then for other people, it just doesn't. You know, they don't feel better after surgery, and there are a whole number of possible contributing factors. Of course, things happen in surgery, like if anything happened to the nerve, and that's what I want to get across too. You know, we're talking about these cells and like the nerve, even a nerve bundle that you look at in the body, they're all tangled. That's like thousands and thousands and thousands of axons together in one like fine little nerve that you see, that you can see with the naked eye. That must be thousands or millions even of individual nerve cells. So you can imagine nicking a nerve, you might do some serious damage to hundreds of different neurons. And honestly, it might even only take one. Remember how I said like these neurons are some of the biggest in your body because the cell body's in the dorsal root ganglia and the process goes all the way out to the body. Even one neuron might cause a situation where you're getting chronic pain from damage. So it's not like when the doctor says we can't see anything wrong, it's like, well, you know, that's not surprising because the damage can be very, very subtle. And it can be anywhere in the pathway from the body up to the brain in that pain pathway. So chronic pain, there's some kind of transition that happens in some people from acute pain to chronic pain, and that is the focus of a lot of research right now. What happens and why does it happen in certain people, and how can we really now there's a push to like, how can we identify people who are vulnerable before they develop chronic pain? And is there anything we can do to stop that transition? That's a big push right now, and that I think is going to be really important for fighting this huge epidemic of chronic pain, rather than waiting until people have gone to 5 or 6 doctors and had 4 failed surgeries and they're at their wits' end and people are telling them there's nothing we can do, catch them at the beginning.